another amazing evening. We greet you all in the name of our Lord Jesus Christ. Thank you so much for choosing Church of Uganda Family TV. We are here with the Health Pot. Health Pot is a program brought to you by Makerere University School of Public Health, together with Church of Uganda Family TV, and we are centered around maternal and child health, early childhood development, but of course we talk about other public health concerns, like the one we are going to talk about today, which is very, very common, and it is important that you, our viewer, you listen through, you follow through, and by the time we conclude, you will have learned a lot, because what matters is your life. We want you alive. That is why we are here. Edrine Osteen Mukalazi is my name, and we have guests from Makerere University Environmental Health Students Association, which is part of Makerere University School of Public Health. And today we are going to discuss non-communicable diseases. Very, very important that you, as a viewer, get to know what these are, what are they, how are they, how do we acquire them, how can we prevent them. So a lot more you should be waiting for in today's episode of Health Pot. I want to introduce this gentleman. We have the one, Eric. Eric,
Yes, sir.
a good evening to you.
Good evening.
Yeah, kindly greet our viewers, and then, yeah.
Okay. First, I greet you in the name of Almighty God. Thank you, Mr. Moderator, for the opportunity granted to me to air out some issues to our viewers. Thanks for watching.
We also have Francis on my immediate left. Francis, you're most welcome.
Thank you, sir.
Yeah.
Okay, our dear viewers, I greet you all in the mighty name of our Lord Jesus Christ. My name is Shimiyu Francis, a second-year student of Environmental Health Sciences from School of Public Health. I come from Bali. I'm a Mugisu.
Oh,
Thank
Mulembe.
you.
I'm not.
I'll teach you.
I watch
You
them.
know.
I know.
Oh, that's good. That's
yeah,
good.
well, we are talking about non-communicable diseases, and we want to understand a broader context of non-communicable diseases. But just to start with, maybe Francis, now that I can speak some Lugis well, but then you first.
Okay, it's fine.
How can you define non-communicable diseases?
Okay, thank you, sir. To our viewers, non-communicable diseases, these are chronic diseases that are non-transmissible. By saying non-transmissible, I mean they cannot be transmitted from one person to another, which means you as an individual, you play 100% to the occurrence of this disease. You're not going to contract it from someone, it's you yourself. Your efforts can prevent it, or your efforts can make you a victim. With non-communicable diseases, they have existed for long. In the past, they were known to be the diseases of the rich. They occurred in the developed countries, and that's where we had most cases. But of recent, we have these diseases occurring in low-income and medium-income countries, of which Uganda is also one of them. For example, in the study that was made by Non-Communicable Diseases Survey in 2019, it indicated that over 4,700 deaths were recorded from diabetes. So this shows how worrying non-communicable diseases are, and we are really at risk. It's really alarming unless something is done about it.
Do you know that up to now we have communities that still say those are diseases for the rich, or those are diseases for people in Kampala, or people think in villages these diseases are not there.
Very true, very true.
I think that is why even healthcare services are much pronounced in the central here. And
it is that most of the people in our communities there, they think cancers, diabetes are for the rich, So you tell someone, he'll be like, each day I just take 1 spoon of sugar. How is this a worry to me, But the fact is, the environment we are in, the lifestyles we've adopted too, they really put us to a risk.
Okay.
The disease is now not for the rich, it's not for the poor. It's not for the old, it's not for the child. All of us are at risk of this disease.
Like you said, that someone contributes 100% to to its coming. So we shall get into that. But talking about non-communicable diseases, it's important to know a lineup of these non-communicable diseases, because in some places, especially when you go to some villages here in Uganda, you realize that people say it is witchcraft. So the moment you see this and this and this, then probably your aunt might have cursed you, or your neighbor who you're crossroads with should have done something, so you also seek the same. But what are some of these diseases, so that we can know the category of diseases that fall under non-communicable diseases?
Okay, thanks, Mr. Moderator. But as you have said, some people call it witchcraft because at one person, for it cannot occur to your brother if I'm having. So it is very easy to say that it's witchcraft. Yeah,
you're right.
Yeah, the examples of these diseases, first you have diabetes, which is occurring at a high rate, because this is where you can find a population. For example, you can find four people, but 2 are having, but they don't know, because they don't want to go for medical checkup.
We only wait at the severe state. When you see those severe signs, then you go and they tell you, you have diabetes.
That's where they progress and it can't be cured.
Yeah.
Okay.
And another disease, you have cancers. Under these cancers, we have got lung cancer, breast cancer, prostate cancer, and these are due to what we do. And another example of the disease, we have mental health disorders. To break this and to understand it more, because most of us have got this disease, but we don't know.
You know, there is a saying in Luganda that but the degree of madness matters.
Even Ragadi so yeah.
So I think we really need to know how this now falls under the non-communicable. I thought now the environment causes it.
Yeah, still it's the environment, and sometimes it's what we do.
Okay.
For example, the depression. And most of the youth are suffering because of this disease, but we don't know. We are being depressed by a lot of things, which even you cannot tell our parents or anyone.
Like
for
love.
example, youth are fighting there in their groups. So when they fight, sometimes they are injured and they begin getting that stress. For example, you can be at a situation where you are limited to moving to certain areas. Already you are having a mental depression. Sometimes you may lose your beloved one. For example, your parent may die, and you become depressed. To add on, we can look at the kidney diseases. You can have a kidney disease, but you cannot transmit it to me. So, under the kidney disease, you can have the kidney failure and the kidney stones. But to add on more, it needs those specialized people to explain more about that.
Well, there's another one that you are not talking about, which is also very, very common, which is hypertension.
Hypertension, the heart diseases.
Yeah, this is I find this very, very common, more common than even some of the ones you've talked about.
Yeah, it is always under my examples, but sometimes the arrangement.
Okay.
Yeah, true.
So I rushed you into there.
But it's okay.
It is important. Are there any more forms that you're talking about? The commonest, because we want to talk about the commonest, that people can really know that if you're living with someone with maybe hypertension or diabetes, you cannot acquire it from them.
Yeah. The commonest, we have heart diseases, diabetes, cancers, mental health disorders. Sometimes the kidney diseases are also there, are also occurring at a high rate. But sometimes we don't want to go to the hospitals to be diagnosed because we think they are going to ask for more money. And
that is luxury. That is a mindset that going for checkups is a luxury.
And it's meant for the rich.
Those who have excess money.
Yes.
Yeah,
which
it is not the
actually
case.
very, very because you realize that most of these that you're talking about,
Yes.
I believe they're manageable if they're
Diagnosed
discovered
early.
or diagnosed early. I
Very
believe
true.
they're manageable. But for us, you wait when you can't walk anymore.
And you cannot leave even your bed. They just carry you to take you for the treatment.
To add on that,
Yes.
as environmental health students, that's where we come in. That prevention is better than cure. And for health, prevention is our first priority. Because you realize, if at all, let's talk for the example, let's take the case of cancer. If at all cancer is diagnosed at an early stage, stage 1 and stage 2, doctors always say it is curable.
Yes.
But if at all you go for this screening a bit later, when it has already progressed to stage 3 and stage 4, then the best they can do is offer palliative support, but it can't cure. So it's really, your health is your responsibility as a person. No one is going to carry the burden, but it's you yourself. Okay? If you take your life serious, because life has no spare. Once it's destroyed, once it's gone, that's the end of it all. So let's take life serious. Let's stand up for this screening. If at all it's diagnosed early, then it can cure. It can cure. Yeah.
That is the hope we have. Now, talking about non-communicable diseases, because you say that these are diseases that are caused by our lifestyle, by the way we conduct our lives.
Yeah.
You know, we sometimes say life is short, you should live it at its fullest.
Enjoy.
But it's very
Such
dangerous.
things. But I look at the risk factors associated with these non-communicable diseases. For instance, what are some of these risk factors that we can highlight?
Thank you, Mr. Moderator. Risk factors. What puts us at risk of these diseases?
Yes.
I'm going to group them into 3. And I'm going to have the modifiable risk factors. These are the lifestyles. When I talk of modifiable, that means they can be changed by you yourself. Under here we have things like physical inactivity. Okay, you're busy eating, you're eating the fats, you're eating the sugars, you're eating the salts, and you're not exercising the body. The sedentary lifestyles. You're at your workplace from morning to evening. You came driving, you go back driving. You're working from Monday to Saturday. On Sunday, you're going to church. Monday, you're resuming the cycle.
For instance, on this building, you park in the basement, you enter the lift, you come to the 13th floor, enter office, you sit, go, enter the car, drive, go home, take it into the garage,
Very true.
enter.
And you're consuming these fats, so they are not burnt. They're going to accumulate in the body, putting you at a risk. Okay? Yeah. Then another risk factor is alcohol use. Okay? Most of the youths are using alcohol, and it really puts us at a risk.
And you know what hurts me is why I don't understand certain things. Even the manufacturers say alcohol consumption is dangerous to your life, but you continue taking it, even when you know it is dangerous to your life.
Maybe as people, sometimes what we know is not what we do. Like, you know, the fact that this really kills.
Yeah.
Talk of smoking. They even they illustrate maybe a sick liver there on the packet, but someone shows you that why life is short. Someone tell you at one time I'll die. Of what reason is dying with a good liver? But this is real, but we need to change the mentality. Okay?
Well, talking about smoking and those others, let's take a short commercial break. When we come back, we are going to continue with the risk factors associated with non-communicable diseases. Stick with us. Welcome back from the commercial break. This is Health Pod. Edrine, Osteen, Mukalazi is my name. We are talking about non-communicable diseases. Just in case you are joining us now, this is the second part of this program. And just to remind you that this program is brought to you by Makerere University School of Public Health. Francis, before the break, you were taking us through the risk factors.
Yeah.
And you talked about alcohol consumption and smoking. You talked about the inactivity.
Yeah, the physical inactivity.
Yeah, the physical inactivity. What are the other risk factors that you can highlight?
Okay, the other risk factors. Another thing is the unhealthy diet. Okay, the diet, the food you're eating. That nowadays, someone's socio-economic status is measured by through the foods they are consuming.
What they eat and where they eat it from.
Where they eat it from. To know that someone is rich, then he's going to consume foods that have high concentrations of fats, salts, and sugars. Not knowing that they are shortening their lifespan, this really puts us at a risk. Another thing, the environmental factors. Okay, we have pollution occurring everywhere. Air pollution, trust me, the moment you get outside there, then air is totally polluted.
Exactly.
And on that, we base on that to say that everyone is at a risk because the environment is a common, I can say it's our common plate. All of us are swinging in it, okay? So we really need to take care of ourselves. The environment is polluted, there are chemicals that we are exposed to at workplace, you know, those working in some industries, we are really at risk of these diseases. Then another thing, risk factors, there are some metabolic factors. For example, we have raised blood pressure, we have increased glucose, we also have obesity. These really put us at risk of non-communicable diseases.
Okay.
Yeah.
You know, when you talk about pollution, you remember sometimes you go to villages, deep villages, and you realize you're breathing in totally different
air.
Yes. You're like, what do we breathe in
In Kampala, as if it's manufactured air. Very
You
well.
realize the air is so fresh, and you can simply notice the change. That is very, very important. Now, Eric, let's talk about do you have any other risk factors?
Yeah.
Okay.
For my colleague, there is what we call age. It's also a risk factor. For example, our young brothers below the age of 7 years, they prefer more of sweets, fatty foods, and I think this can be played a lot by our parents because they are our guide to tell us what to do. So that becomes a risk factor. And in the elderly, that one is also, they are also more affected by these diseases because of their physical inactivity.
We actually have some hospitals who are specialized in what deserve
Very true. And these are the diseases that are most people.
They are treating more of the non-communicable diseases because they are of physical inactivity. And we shall talk about the sex. So this one comes in, for example, if you move around Kampala right now, you are going to find more of the men and find some less women. This is putting us at a risk because we are the men who need to work for our families.
We are so much exposed.
But
these days, especially in Kampala, you go to Chikubo, it is balanced. Everyone is Kuyiriba.
But along the roads, they are more of the men because, for example, the border guys are always staying there and the air is polluted, meaning that's the air they are breathing in. Okay. And another one, I can look about at the urbanization.
Okay.
In urbanization, this one comes with a lot of things that can expose us to non-communicable diseases. For example, if you happen to come in town, the first thing you need to think about, now let me change my diet. In the village, I've been eating.
I'm sure you place someone who's in Kampala. These things don't happen in our village.
Very true.
Now that one alone, it is more exposing us to non-communicable diseases. And we know in urbanization, it is coming with industrialization, which industries are polluting our water if they dispose in water bodies, meaning the water we are going to drink is already polluted. At the same time, they are raising these fumes, which you can inhale in while breathing in our air. That's what I had. Maybe I can go to my part.
Let's talk about the vulnerability, the vulnerable group.
In the vulnerable group, all of us we are at risk. That's the main issue. But we can bring in some factors which are making us to be vulnerable. For example, if I say all of us, I'm including the children, the ladies, the men, meaning the whole population is covered. So in the children, sometimes children have got some like mouth. If they get an object, they can easily put it in the mouth. Sometimes they may get these objects where they are already contaminated. And when they are contaminated, for example, you may spray in the house to kill some insects, and the children may find some object already sprayed. So when he eats today and another time eats, at some point it may result into cancers. And for the youth, it's more of the working opportunity, working class, because the traffic in Kampala or anywhere else, it can increase our exposure to polluted air. And sometimes the jobs we do, for example, people working in industries and they are not properly protected, they can be exposed to dangerous chemicals which can result into these diseases. And for our elderly, for example, my grandma in the village there, you cannot tell her that move around. It will be like punishing.
It's a punishment.
It's a punishment.
But we have those who are energetic. They walk.
Yeah.
and you know, at 80 or 90, they are still strong.
Yeah.
It's as if they are 60, and you find someone of 50 years already breaking down.
Yeah, and they
That's
break
it.
down due to some physical inactivity.
Okay.
Yeah.
Okay. It is very important because here we, like you say, that they are more into prevention. But here, especially on this program, the reason we come here is to prevent some of these occurrences, to help you do what you can do in order to prevent the occurrences. Now, it is very, very important because, truth be told, non-communicable diseases are expensive to manage or to treat. Very, very expensive. You need to do a lot, you need to give in a lot of time, but also the discomfort you get as an individual. So it is really important that you pay attention to the preventive measures because they are workable. You too can, and that is what we are going to look at. Francis,
Yes,
if we can start with you, what do you think people can do to prevent or control non-communicable diseases?
Okay, thank you, sir. Before I move to that part, maybe I can highlight briefly on the socio-economic impacts of these non-communicable diseases. First, of the impacts it creates. One, if you are a victim, for example, of cancer, then you're not going to work. You're not going to work. Then look at this person who is also taking care of you, then in the hospital. To appreciate this best, then our dear viewers, get time and visit the Uganda Cancer Institute. You're going to appreciate this
All
point.
the Heart Institute.
All the Heart Institute.
And you know what
Okay.
you find there is...
Either you have a friend who has faced this, or you have your relative, or you've lost one of your dear ones due to non-communicable diseases.
And if they want to prove, and maybe you don't have a relative who has been to that, just pass by. They'll not send you. Just pass by and see what happens.
Move around.
Go to Mulago Cancer Institute or Heart Institute. The numbers you'll find there are overwhelming.
Very true. Then also the cost of treatment. You realize, if at all, for example, I come from Bali and happen to be a victim of cancer, that in 2022, I had an uncle who passed away because of cancer. So we were always incurring transport costs. You move from Bali, you have to come to Mulago, you stay for 2 months, you go back to Bali, but finally he went. So this thing is serious, it's really alarming.
And then, if you don't have relatives around Kampala, then you have to pay for accommodation. For the time you'll be there.
You have to rent. So it's really, it's a burden, and yet we can prevent it by just some small activities, as we are going to see. So when you talk of prevention of non-communicable diseases, first, you need to realize that you are a victim. You who is viewing, I who is speaking, and you the moderator. We are all victims of non-communicable diseases. We are all at risk. So we need to do something before it's too late. Trust me, if you do the following, then you're going to reduce your risk of getting some of these non-communicable diseases. One, physical activity. Okay? Yeah, exercise, regular exercise, once in a while, like after work. if at all you know you're not, maybe you don't come from far, like your workplace is near home, don't board. Move around, jog, once in a while on weekends, play some soccer, okay? Yeah, play some soccer. You can attend some dancing classes. You can visit a gym, reduce on the fats. Then the other thing is, let's adopt to a healthy diet. Know what you're eating. It's not a matter of eating whatever you're served on the table. Just because someone has taken you for an out, then you have to order for chips and chicken. Not really. What effect is it having on your life? Let's reduce the consumption of foods that have high concentration of fat, sugar, salts. But then consume more fruits and vegetables because they're really good. Another thing that we can do to reduce the risk of getting these non-communicable diseases is reducing the tobacco and alcohol consumption. Okay, we really need to reduce because that played a great
but now, since they don't carry any nutrient in them, we just discourage people from taking. Because when you take it, there is nothing you're bringing. You're adding to your body instead you're causing a lot of risks.
Very true.
You can't do without alcohol.
You can just leave it.
Don't be this patriot who say, when I don't buy water, I'm not supporting.
But those people also have children, they have to educate. Why? No.
But why should you sacrifice your life? For their children?
So let's take these things serious. Then another thing
Francis, you spoke of tobacco, but someone may think specifically tobacco, but also these drugs like marijuana, they also cause these diseases. So someone may say, if I leave tobacco, let me go to marijuana, which is also very dangerous.
Yeah, very true.
And unlawful. Its consumption is actually unlawful.
Yeah. Then to proceed, we also need to strengthen the healthcare system. Okay, you realize, as you said in the beginning, that most of these services are around Central. Okay, for example, the Cancer Institute is in Kampala, the Heart Institute, most of the treatments are done this side. But if at all we can have these services easily accessed to even our local people in the villages there, I'm sure it can create an impact. It can reduce on the rate at which these non-communicable diseases are occurring.
We are actually grateful to the Cancer Institute that they are now opening up centers. They are soon launching the Guru Center, then the Mbarara Center, then the Mbali Center. Yeah, at least that will, I think, reduce on the burden. Yeah,
but still, it comes to you as an individual. Even if these services are there, even if they have launched, they have opened these services at our district.
They are not yours.
If at all you've not gone there to seek for medical assistance, eye screening and diagnosis, then they'll just be there. But they have come to serve us. Our take home today is, after realizing that you're at a risk of this disease, then tomorrow, if at all you're free, get time and gun, check yourself. Okay? Regular screening, at least once in a month. Screen. If at all it's detected early, it's cured. If at all you delay, then you're at a greater risk. Another thing that we can do is vaccination. For example, we have the HPV vaccine for the females above the age of 12. Okay? Back there in the villages, some people tend to politicize health. No, these are programs of what, but just know your health is key. If at all the Ministry of Health has come up with this campaign against the cervical cancer, please, our dear ladies, let's go in for it, okay? Like when you're vaccinated, your risks are minimized, okay? Yeah.
Thank you so much, Eric, Francis. Eric, we are running out of time, but what is your submission, briefly?
To add on, I'll begin by raising our awareness as health. So, for example, here we are distributing knowledge and awareness to people. Assuming I watch the program, then I get that knowledge. Let us also help those people who are not aware. You tell a friend to tell a friend. Because at least if you know something, you can change the behavior and prevent the disease. And another thing, let us support for mental health. we can support this because, for example, do you know that people are suffering from this mental health disorders because of the surrounding? People around us, if you are isolated, you can develop that thinking, which in turn it can affect you. And also the practices we are doing at home, the violence, assuming you are a woman and you are being beaten by a man, you begin having some mental issues. So, in simplicity, let us at least try, and we do these things. We can reduce the risk, and in turn, we never know. Things may become to a level which is manageable and help our population to grow. Because the more we prevent, the more we are creating opportunities for us to do other things.
True.
Yeah.
Thank you so much, Eric. In less than 10 seconds, please send out your greetings out there.
Okay, thank you, Mr. Moderator, for hosting us and giving us this opportunity to air out some information which is vital to our living and health. I'd like to appreciate the organizing committee for this program, the Family TV, for the time and for the love you have shown for the population, because this is real love, to enable our people know and prevent this disease. And also I would like to appreciate our school for supporting us, because without them we cannot be what we are. Thank you, Mr. Moderator.
Thank you so much, Francis.
Yes.
In less than 10 seconds, please conclude.
Thank you. First, I'll thank the Church of Uganda Family TV for hosting us here and giving us this platform to share the knowledge to our communities. Then I'll thank the Marcus PH for giving us these ideas, because I can't lie to you that we were born with them. I thank all viewers there who tune in to Family TV. I thank all the BAMSA, the Bamasaba, Bamasaba students at Makerere. I also appreciate all the environmental health students in Uganda who have subscribed to Federation of Environmental Health of Uganda, where I happen to be the incoming Secretary General. I thank my father, must have had some in Bali. Yeah, he's the reason as to why he has paid very much for me to be here. Thank you, Mr. Moderator.
Thank you so much, Francis. Thank you so much, Eric. And thank you so much, you, our viewer. It's been a pleasure having you from where we started from up to now. All I can say is stay tuned on Church of Uganda, because Church of Uganda Family TV, because we have a lot more coming up. Stick with us.